Hello friends, let us now go to our next video in the series MCQ for you. I'm Dr. Amit Desai. I'm a surgeon and I take lectures for FMGE and NEET PG. So now the question is that thimble bladder is seen in. Thimble bladder is seen in. And so what is the answer? The answer that is expected is chronic tuberculosis. Thimble bladder is seen in chronic tuberculosis. What happens? The shape of the bladder becomes contracted. All right. So what happens? Tuberculous bacilli, they usually affect the kidney. All right. They are usually there in the periglomerular capillaries. Now, once they affect the kidney, once they come into the urine, what happens is that this urine starts coming out through the ureter into the urinary bladder. So, from the ureter, they come to the ureteric orifice of urinary bladder. All right. And urinary bladder is affected. Once it is affected, there are lesions, there are ulcerations that take place, and these lesions, when it becomes chronic tuberculosis, what happens is these lesions heal by fibrosis. Okay, these lesions heal by fibrosis, and because of the recurrent fibrosis, what happens is that the entire bladder becomes fibrosed, its capacity decreases, and what we get at the end is the resultant called as thimble bladder. Now, for thimble bladder, we need to do surgery. And we first start, of course, with the anti-tuberculous treatment, but we need to do surgery, and that is augmentation cystoplasty, where ileocystoplasty, where we use a part of the ileum in order to increase the size of urinary bladder. So it is called as augmentation ileocystoplasty. All right. Now, if you liked this video, please subscribe to our channel ADSL Academics. Please hit the like button and also press the bell icon so that you will be able to get the notification for all the subsequent videos that we make. Thank you very much.